Hello and welcome to Fertile Mind. My name is Dr. Violet King and I'm a fertility specialist at Melbourne IVF. Today I'm really excited to talk to you about elective egg freeze. The most important thing is that we give you the information that you need to make a decision and to understand the process fully about elective egg freeze. Freezing your eggs is not a guarantee of a live birth in the future, but it is a longitudinal or steps throughout your life to preserve your fertility potential. So some people actually might use their eggs not just for their first baby, but also plan if they want a second or third babies from their frozen eggs. It's really important that you have a full discussion with a fertility specialist and have investigations. And these can include blood tests, hormones, as well as ultrasounds of your ovaries and uterus. We also have our supportive counsellors, our fertility nurses, and our patient liaison officers to explain to you each and every step of the way. Don't hesitate to ask any questions. The process of egg collection. Once you've made that decision to go forward with egg freeze, there are a few steps that I'll break down for you. The first one is the fertility specialist and the nurse will go through with you your medications. And really what it is injections for about 2 weeks that helps you grow not one, but several eggs at a time. During this time, we'll have 2 or 3 ultrasounds over the 2 weeks to count the number of follicles and also their size, and then determine when we'll go to theatre. Now, I'll go into detail here about what actually happens in theatre. You will be told when to take your trigger injection, and then 2 days after you'll have your egg collection. You will be told to fast before the procedure because it is under sedation, and you'll have an anaesthetist who will look after you while you're asleep for that 15 minutes of the procedure. You will definitely be asked for your 3 points of ID, so we have accurate checking of the right person, the right place at the right time. We'll have our theatre nurses on hand to answer any questions you may have. In theatre, once you are asleep, we'll use a gentle ultrasound probe and a fine needle to look and aspirate, that is, draw the fluid of the follicle. Interestingly, a follicle is hundreds of supportive cells called granulosa cells that support the one egg. The egg is the biggest human cell in the body. It's pretty special and it floats in the follicle. So as we aspirate it, the scientist who's in the theatre, the embryologist, will look down the microscope and count and put the eggs in separate wells. We'll do this until every follicle is drained to capture all the eggs. Then you'll move to, there's 2 things. First for you, you'll move to our recovery. Well, you have a recovery nurse who will talk to you, make sure that we're on top of your pain and give you some food to eat. The other journey is the journey of the egg. Once the eggs are all labelled, and again, we very carefully identified all your ID, then the scientist will move that into the main laboratory. If the decision is for egg freeze, then we do what's called vitrification or fast freeze. This is a revolution in science. And in fact, in 2012, the American Society of Reproductive Medicine, ASRM, deemed it no longer experimental. So we have a decade of refining the vitrification process. It actually means glass-like state. And how we achieve this is by using liquid nitrogen. The embryologist will then put each egg on the tip of a cryo or a frozen storage device and put the egg through a series of cryoprotectants, that is to shrink the egg down so that it decreases the chance of any ice crystal formation or anything that might change the structure of the egg. Once they put it through the special series of cryoprotectants, then that single egg is plunged into liquid nitrogen to minus 196 degrees Celsius, which is where biological activity remains in stasis. And it can be in stasis indefinitely. no biological activity occurs at that temperature. Again, having gone to the lab and watched them, they carefully put your eggs into the canes, label it, and then into what they call a DEWA, or a nitrogen container that is carefully electronically monitored for temperature with alarms and double security systems. So that's the journey of you having your food in recovery and the journey of your egg safe in our lab. At the end of the day, if egg freezing is something that you wish to explore, please come and speak to one of our fertility specialists to see if it is the right decision for you. More than happy to offer you all the information. Thank you for watching Fertile Minds today. If you'd like to hear more content, please like and subscribe below.